Calve Legg Perthes syndrome. What is it? Calve Legg Perthes syndrome, also known as avascular necrosis of the femoral head, is a rare condition that affects children aged 4 to 10 years. This condition is characterized by a temporary interruption of blood supply to the femoral head, leading to its gradual degeneration and tissue death. The exact causes of Calve Legg Perthes syndrome are not fully understood. It may be related to impaired blood flow due to narrowing or blockage of blood vessels, which can be triggered by various factors such as genetics, trauma, or infection. However, the precise causes still require further research. Children suffering from Calve Legg Perthes syndrome may experience the following symptoms: pain in the hip or knee, limping or difficulty walking, limited range of motion in the hip, and muscle atrophy in the thigh. The Calve Legg Perthes syndrome is dangerous as it can lead to deformation and deterioration of hip function. If the disease is not detected and treated in a timely manner, it may result in the development of arthrosis and future walking problems. The treatment strategy for Calve Legg Perthes syndrome depends on the stage of the disease. In the initial phase, it is recommended to limit the load on the affected hip and to use crutches or a wheelchair for support while walking. Physical therapy and exercises can be beneficial for strengthening the muscles and maintaining joint mobility. In some cases, surgical intervention may be required, such as osteotomy or hip arthrodesis. The prognosis for children with Calve Legg Perthes syndrome varies depending on the degree of damage to the femoral head and the effectiveness of treatment. With early detection and adequate treatment, most children fully recover and have a good prognosis, but in some cases, there may be lasting consequences or the need for additional surgeries in the future. In general, Calve Legg Perthes syndrome is a serious condition that requires timely detection and adequate treatment. Regular checkups with a doctor and adherence to treatment recommendations will help achieve the best results and prevent possible complications. I believe that after reading all of this, you now understand why periodic examinations by a pediatric orthopedic traumatologist are so important, especially when suspicious symptoms related to the musculoskeletal system appear.